Good afternoon, ladies and gentlemen, and welcome to our Chambers Let's Talk Health and Safety with Rhino Safety today. On the panelists that we have today, joining us, we've got Dom Hibbett, who's our events coordinator, who, if you have any problems with the webinar or you have any issues throughout it, please feel free to contact Dom in chat and he'll try and help you as best as possible. I hope everybody's well on this very nice day. And today we have our premium members, Rhino Safety, who will be covering health and safety. And I would like to say thank you at this point to Cate and Simon for coming on and providing a presentation. We are recording this seminar so that you may want to refer back to it again, but also our other chamber members can take advantage of the knowledge that Cate and Simon are going to share today. If you have any questions, please post them in the Q&A section, which will be at the bottom of your screen. And we'll be picking up questions round about 3:10. As this is a webinar, you'll not be able to, we will not be able to see or hear you. So, but if you have any concerns, you can always put your hand up or let us know. So I hope you find the webinar useful. We will have a question and answer session after the presentation. So without further ado, I'll hand over to Cate and Simon Walter. Thank you.
Thanks very much, Paul. Yes, we are. First of all, I'd just like to say thank you to everyone for joining us. I'm very impressed that people are taking time out of their afternoon on this glorious day to listen to a webinar about health and safety. So thank you for joining us. We are from Rhino Safety Ltd. Hopefully, you know that we are a premium member of the Chamber and we are a health and safety management consultancy. So we've been going, it's actually our 5th birthday on Monday, so we've been going for 5 years now. Simon and I are obviously a husband and wife team, but we've got a team of 8 now based in our offices here in Sandbach, and we are a multi-award winning company and have had huge support from the Chamber in the past 5 years, and so we're delighted to be able to help them in presenting this information to you. So I will just skip through this quickly. These are some of the clients that we work with. We work with clients all over the country, and we work with anyone really from sole traders right through to some large multi-site international organisations, as you can see on the slide there. So the purpose of today's webinar really is to talk to you about the implications of reopening your businesses or restarting work if you have been closed for a period, or even if you have been continuing to work but want to make sure that as you perhaps bring your team back from furlough, or if you've got members of staff who are returning from shielding, that you know how to do that safely and compliantly with the COVID guidance that's come out. So that's going to be the focus of today. It's not just a general health and safety presentation, it's very much focused on the reopening of businesses. So I will crack straight on with that. So you may be aware that on Sunday the 10th of May, Boris Johnson announced something called COVID-19 Secure. And this was the official guidance that the government have brought out to help businesses to reopen after a period of closure during the lockdown period. So he announced this on the 10th of May. The guidance was officially published on the 11th of May. So, and that was Monday, the 11th of May, and a lot of businesses were looking to reopen from Wednesday, the 13th of May. So it didn't give a huge amount of time for preparation. Fortunately, we had access to the draft guidance in around about the 10 days preceding the announcement. So we've been working hard to already familiarise ourselves with what was going to be published. And thankfully, there weren't too many changes that were made. So we've managed to get to grips with the guidance, and what I'll be doing through this presentation is taking you through it, talking to you about how it applies to you and your business and the sorts of measures that you need to be taking off the back of this. So the official guidance, you can see at the bottom of the screen there that there is a link to that official guidance. If you don't have time to take down that link, then basically if you put into your search engine COVID-19 secure guidance, it will come up as the top result for you. So this guidance is working safely during coronavirus COVID-19. It's known as the COVID-19 Secure Guidance, and it is technically aimed at employers, employees, and the self-employed. To be perfectly honest with you, I think this isn't something that many employees are going to be reading through at bedtime. It's very much aimed at business owners and talking about their responsibilities and their liabilities. It is worth knowing that this does only apply in England. The devolved administrations have their own guidances. So if you are working in those areas, even if you are based locally to us here in Cheshire, if you are working in any of the devolved administrations, it's worth checking out their particular guidance for that area. So the guidance itself, there's technically 8 guides. They are all aimed at different industries and sectors. They are all very similar to each other. So they do vary slightly in terms of the way they advise certain things for certain sectors, but the general premise of all of those guides is very much applicable across the board. It is worth noting that for certain businesses, there may be more than one guide that is applicable to you. So for instance, if you are a business that has an office and a warehouse, then you're going to need to look at both sources of information there. Likewise, you might have an office and a retail unit, or you may have a workshop. So it's worth checking those out and just making sure that you're familiar with all the different guidance that's being applied to you. Educational and childcare settings are not covered by this particular documentation. They have their own separate guidance. And if that applies to you, for instance, if you are in a children's nursery setting or something similar to that, after school club perhaps, then feel free to get in touch with us and we can signpost you to the relevant guidance for you. It's worth noting that although this guidance was published on the 11th of May, that doesn't mean that you are automatically allowed to reopen your business just because you can comply with that guidance if you're not permitted to do so under the current government rules. So obviously over the past couple of weeks, we've heard more in terms of timescales and dates that are applicable, and obviously from the 15th of June, non-essential retail businesses may be able to open, but it's definitely worth making sure going to that link and making sure exactly when you will be allowed to reopen, because compliance doesn't automatically mean you can reopen if it's not currently permitted. It's worth noting things like beauty salons, hairdressers, tattoo parlours, all of these are going to have to wait for quite a bit longer, and obviously the hospitality industry as well are going to be waiting for a few weeks yet before they can reopen. Finally, I would just like to mention on this slide, it is guidance, it is not legislation. So it's worth taking on board the fact that if you are unable to comply with absolutely everything within the guidance, that does not mean that you are going to be acting unlawfully if you reopen your business. It is being put forward as something to help businesses to reopen, as opposed to something that they have to comply with every single letter of. So please, if you're looking at this guidance and feeling quite sort of afraid or worried or concerned that you can't comply with all of it, feel free again to get in touch with us for further advice, because it doesn't necessarily prevent you from reopening. So that's just worth mentioning there. So those categories that I alluded to before, you can see there on the screen. So like I say, there are separate guidance documents for all of these categories: construction and other outdoor work. That's worth noting as well. That covers things like, if outdoor work would be things like gardeners, landscapers, that type of business are covered there. Factories, plants and warehouses, labs and research facilities, offices and contact centres. Other people's homes, again, just clarifying that would be things like cleaning companies where cleaners are going into people's homes, potentially au pairs, that sort of thing, covered under that one. Restaurants offering takeaway or delivery, that's very specific because, as I say, the hospitality industry as a whole are not able to reopen yet, but obviously there are certain restaurants that are still offering that takeaway and delivery service, so that's particular guidance for them. Shops and branches, and finally vehicles. Note there that lists out the types of vehicles that that's referring to. That does include those people who may travel in a vehicle as part of their working day. So if you have someone who is office-based or home-based, but then uses their vehicle to travel to a different site, that particular guidance there covers them. So in terms of the guidance itself, it sets out 5 steps to working safely. So these are the 5 steps on screen that the government have set out businesses need to be doing to make sure that they can continue to work safely or that they can reopen safely. So first of all, you need to carry out a COVID-19 risk assessment. So that is a very specific risk assessment that you need to be doing that is separate to any other risk assessment that you may already have in place for your business. You need to develop cleaning, hand washing and hygiene procedures, and that will include what is expected there is an enhanced cleaning regime. So you need to be thinking about high contact touch points like door handles and the sort of other surfaces that you have within your premises that are going to need an enhanced cleaning schedule. Help people to work from home. So even though that the restrictions are starting to be lifted and eased, lockdown is being eased, there is still a huge emphasis placed on where people are able to do so, they should continue to work from home. Maintaining 2-meter social distancing where possible. Now, this is a really important point. There has been a lot of discussion. We've received a lot of concerns about how 2-meter social distancing can be implemented within workplaces. The guidance is very clear. You should implement it where it is possible, but there is an acceptance of the fact that that may not be possible in all workplaces. And we'll come on to that a little later on. And finally, where people cannot be 2 meters apart, managing that transmission risk. And as I say, we'll talk a little bit more about that further on in the presentation. So the focus for today is that risk assessment. This is the key part to reopening and continuing to work safely during the coronavirus pandemic. So some points that you need to consider. The risk assessment must be completed prior to restarting work. Now, what I would say is that if you have continued to work and you don't have this risk assessment in place, or if you have just restarted work and don't have the risk assessment, please don't panic. This isn't something where somebody's going to be coming along and checking it, signing it off before you actually open your doors. But it's absolutely essential that you do have that specific COVID-19 risk assessment. So that needs to be addressed as a matter of urgency. Now, the guidance itself states that the COVID-19 risk assessment must be completed in line with HSE guidance. Now, when you go onto the COVID-19 Secure website using the link on a couple of slides back, there is a hyperlink to the HSE on that particular section, which I know some people have assumed takes you to a specific COVID-19 risk assessment template. That's not the case. It's important to note that when the guidance states that the COVID-19 risk assessment must be completed in line with HSE guidance, it's talking about the normal, usual HSE guidance on completing risk assessments, which is those 3 points that you can see below. That you need to identify what could cause injury or illness, which is the hazard. You need to decide how likely it is that somebody could be harmed and how seriously, which is the risk. And then you need to take action to eliminate that hazard, or if that's not possible, control the risk. So in the case of COVID-19, obviously the hazard itself is COVID-19. And at this moment in time, it is not possible to eliminate that hazard. So this is where you need to think very carefully about this specific risk assessment, and I'm going to come on to that shortly. The guidance also says that your workers, if you have recognised trade unions within your business, they should be involved in completing this risk assessment where applicable. If you do not have a recognised trade union, that's absolutely fine. Most very small businesses do not, but you do need to include your workers where you can in completing this risk assessment. It's always worth consulting with your employees and with your staff, asking them for their views on what they perceive risks to be, where they think any pinch points could be, for instance, and you need to be making sure that they feel involved in that process. Apart from anything, it's really good practice to involve your employees in this type of process, because it provides them with reassurance that you are actually taking it seriously. And finally, the risk assessment must be shared with your workforce and published on your website for businesses of a certain size. I'm going to ask Simon to just jump in at this point. Simon, can you just mention in terms of the types of companies and businesses that should be sharing this publicly, for instance, on their website?
Yeah, the government guidance states that anyone with more than 50 employees must publish their risk assessment on their website. Whether that will be checked or not, I'm not sure. I don't really know the reasoning behind that. I do know Bentley have already done theirs, and theirs is apparently on the website, although I did try and find it, but I couldn't. So I don't know how prominently you do need to display it, but yes, part of the part of the guidance is to make sure that is on your website if you've got more than 50 staff. Now, if you don't have 50 staff, you obviously still need to do it, and you still need to make sure it's communicated to your workforce. We're also seeing a lot of people that don't have many staff but are being asked for it by their clients.
Yeah, that's an important point there, particularly with contractors where they're working on other people's sites, they're being asked to share this risk assessment. So that's something that you need to bear in mind. I would say that even if you have got less than 50 employees, publicly showing that you have considered this this particular situation is going to be good practice anyway. It's going to be good for your reputation, good for your staff morale and things like that. So it's worth considering that.
Can I just add a note there, Kate?
Yeah.
It was released, I think, this week that the HSE are now doing proactive checks again. So during lockdown, they were told not to go out and do any checks, but now it's been increased. Well, now they're back to doing proactive checks. So we're expecting to see them around checking things like if this risk assessment is in place. So that's just important to note that you might not want to have to display this on your website, but if the HSE did knock at your door, and they can do, and you've got to let them in, they will ask for this risk assessment.
Okay. So moving on to the actual sort of mechanics of a risk assessment. Again, I'm going to ask Simon to jump in on these points. There are various things that you need to consider when writing risk assessment, and a lot of these points are the case generally with all health and safety considerations, but there are some obviously very specific points with the COVID-19 risk assessment. So the first point there, are you competent to write the risk assessment? This is a slightly contentious point, and again, I'll ask Simon to jump in here. But this is something where we talk a lot to clients about competency, because the HSE is very clear about the fact that people who are writing risk assessments must be competent to do so, and yet the sort of definition about who is competent is perhaps somewhat ambiguous. So Simon, if you can just jump in there.
Yeah, I mean, essentially it's a grey area, like with a lot of health and safety. It's not very black and white. Essentially, if you're comfortable with your industry, you have the training and experience to write a risk assessment, then it can be classed that you are competent. If you write a risk assessment, so for example, if you wrote this COVID risk assessment and you completely missed something off, and the HSE, came to actually do an investigation into this, then they could look at prosecuting whoever wrote the risk assessment because you weren't competent to do it if someone caught COVID and were following the risk assessment. So if you're unsure, there's a lot of information on the HSE website that talks about competence. So say, for example, if you just run an office, you could argue that you're competent to do a basic risk assessment because you've got a low risk premises. However, if you are running a chemical plant, you could argue, if you're not health and safety qualified in that specific industry, you would not be competent to do that. So if you're unsure of anything, there is a lot of advice out there. You can obviously come to us and ask for advice if necessary.
Okay. So moving then on then to the other points of the risk assessment, there are various things that you need to consider. The first thing you need to think about is who are the people who are affected. Now, this is an important point to note that you need to consider all of the people who may be affected by your work activities. So it's not just about you and your employees. This is about whether or not you have visitors or suppliers, whether or not you have members of the public, whether or not you have clients who visit you. So it's about all of those people that you may come into contact with as part of your work activities. And a very specific point to COVID-19 here is that you need to identify whether or not people are clinically extremely vulnerable or clinically vulnerable. Now, it may well be the case that you are not aware of this as a matter of course. So it's important that you are checking with your employees whether or not they fall into those categories. Obviously, for people visiting you who may be suppliers, they may be employees of suppliers or general members of the public, you're not necessarily going to know, and the responsibility falls on those individuals to let you know if that was the case and they were planning to come to your premises. So that's worth noting there. In terms of in terms of clinically extremely vulnerable and clinically vulnerable and the differences between those 2 points, people who are clinically extremely vulnerable are still expected to be shielding at the moment. So if they are your employees, then you would not expect them to be attending work at all. And likewise, if they were someone else's employees or visitors, you would not expect them to be leaving their home at this moment in time. So it is unlikely that, that you would need to put measures in place for those people other than identifying on the risk assessment that they shouldn't actually be in the premises at all. Clinically vulnerable is a slightly more grey area because this may include people who are not shielding but are at greater risk. So that may include, for instance, people with mild asthma. It may include pregnant people, but like I say, this is a grey area, and it's something that you need to, for either of those categories, you need to be thinking about actually formulating specific individual risk assessments for those people. So that is in addition to your specific COVID-19 risk assessment. You then need to be looking at whether or not anyone can be working from home. As I said previously, there is still a huge emphasis on continuing to work from home where it is possible to do so. So that needs to be identified on your risk assessment. And then the next 2 points are the sorts of things that you would ordinarily be looking at through your general risk assessment procedures. So looking at your premises and looking at your work activities and deciding what measures can be implemented. Now, if you go through the guidance, it suggests things like the enhanced cleaning regime. It talks about the social distancing measures that you might be able to put in place. But it is also very accepting of the fact that that may not be possible in all work environments. I've talked a lot over the past couple of weeks with clients and other people about the fact that, for instance, in offices, most SMEs do not take on huge, great offices with loads of space because of financial implications of rent and business rates and things like that. So it may well be that you are dealing with a small workplace where enforcing that 2 meter distancing rule is not always possible. So what you need to be doing is thinking about, if that's not possible, what measures can you put in place to be protective instead? Examples of that are avoiding people working face to face and having them work side to side or back to back instead, putting screens in place if they have to be face to face, where there are things like kitchens and bathrooms, can you have a 1 in, 1 out policy? All those sorts of things are the measures that you need to be looking at there. Moving on then, personal protective equipment, PPE. This needs to be addressed in your specific COVID-19 risk assessment. If you already use PPE, you need to be referencing whether or not there needs to be, again, any enhanced cleaning measures for it. And if you don't currently use any PPE as a matter of course in your work activities, you need to be considering whether or not there is any that needs to be implemented as part of the COVID-19 risk assessment. I would just like to mention here about face coverings, face masks. There has been a lot of discussion about this. The guidance makes it very clear that employers do not have to supply face masks or face coverings if that is not something they would ordinarily do as part of their work activities. Simon and I have had a lot of discussions about this. Simon, if you want to just jump in here about our advice to clients on face coverings. Oh, I can't hear Simon.
Sorry, I was muted. Yeah, we're obviously using the government guidance, which is you don't have to supply masks to any of your staff unless you're in a clinical environment. So there's a lot of information on the government guidance about that. However, we have been speaking to a lot of clients where their employees are requesting or would feel more comfortable with some form of face covering. So there is a distinction now between masks and face coverings that the government have made. So what the government are saying is any kind of scarves or homemade masks are classed as face coverings and are not protective equipment. So if your staff want to provide their own face coverings, then feel free to let them do so. Make sure they wash them regularly and regularly change them. However, you don't need to provide them masks unless it is a clinical environment. And if you need any more information about that, please let us know, because there is a fair bit of miscommunication out there. The other thing to note is as well, and we've specifically done this, we have got face coverings for our staff who go out to clients, because you may find that some clients or some sites that you attend specifically ask for face coverings or masks as part of their site rules anyway. So even though the government guidance doesn't say you have to provide them, we have some clients that have kind of an enhanced control measures when it comes to COVID and do want those masks being sorted.
Yeah, I mean, the face coverings one is a bit of a minefield, really, but we've very much been encouraging all of our clients that if they have employees who wish to wear them, you should be supporting them to do so, but you are under no obligation to supply those yourselves. So yeah, if there's any questions on that, feel free to let us know. The next one there, first aid. You need to be considering how first aid will be dealt with, and there are two factors to consider here. First of all, how general first aid will be managed, whether or not you need to provide enhanced PPE equipment that you wouldn't ordinarily supply for first aid, because of the fact that people will likely be in close proximity if they're receiving or administering first aid. Secondly, you also need to have a separate consideration of the administration of first aid to people who you may suspect are suffering from the virus. Now, this is, again, a bit of a minefield. You would expect that people are staying at home if they believe they are suffering from the virus. But if you were to end up in a situation where someone ended up in a medical emergency situation, having sort of recently shown symptoms of the virus whilst at work, you need to have very, very specific control measures in place about how you will deal with that situation. And again, that's something that we can help to advise with if that's something you're not sure about. And finally, there are emergency situations. How are these going to be dealt with? So an instance of this that you need to be considering is if you had a fire alarm, whether that was a drill or a genuine fire alarm situation. How are people going to be dealing with getting out of the building and keeping away from each other? Your fire assembly points, where are they? Do they allow people to spread out? It's quite clear in the guidance that there is an acceptance of the fact that you need to prioritize what the emergency is. So if there is a genuine fire emergency and your fire assembly point meant that people were in closer proximity, then it's about weighing up those risks. The risk from a fire situation is probably greater than the risk of the virus in that circumstance, so it would generally be accepted. But you do need to show that you've given consideration to that on your risk assessment.
Kate, can I just make a point? and forgive me if you cover this later on as well, but any control measures that you identify in your risk assessment, they cannot be discriminatory. So, for example, we had a client who wanted to stop members of public coming in their front door and to use a side door, but that side door didn't have a handrail and didn't have any, or had steps and didn't have any ramps, and they have members of public attending their site. Now, obviously, that would be discriminatory for anyone that's disabled or elderly. So you do need to be very, very careful. And it does say in the government guidance you cannot discriminate when putting into practice any of these control measures. The other thing that we are seeing as well is people in shops creating one-way systems and blocking off aisles and things and not taking into account fire exits and travel distances. So you do need to be very, very careful what you're considering as your control measures and making sure they're not impacting on fire safety, like Cate mentioned, the first aid element, or being discriminatory.
Moving on from the risk assessment itself, it's worth mentioning about RIDDOR. RIDDOR is the Reporting of Injuries, Diseases and Dangerous Occurrences regulations. It is extremely important for business owners to know that COVID-19 has been added by the HSE as a reportable disease. Now, I have mentioned this to a couple of people and it's caused blind panic. So first things first, I do want to say, please do not panic. It does not mean that you have to report yourself to the HSE if any employee has contracted COVID-19. The guidance that the HSE have put out on this is actually very, very clear. The bar for reporting COVID-19 as a reportable disease in the workplace is extremely high. And really, this has been added as a reportable disease mainly for the healthcare sectors. So what this essentially means is, what the HSE are saying is that, first of all, for COVID-19 to become reportable by a business owner, it will need to be officially diagnosed. So it cannot just be someone saying, oh, I think I had the virus. They will need to have a formal diagnosis by a medical practitioner. Now, obviously, we're aware that testing isn't quite up to speed yet. So how likely that is in the first place is questionable. But more than that, the HSE have said not only does it have to be a formal diagnosis, but the medical practitioner has to have said that the likelihood is that that person has contracted the virus within their workplace. Now, again, there's been a lot of talk around this in the health and safety sectors and legal sectors. Again, the likelihood of a medical practitioner being willing to actually put their name to that in writing is, I think, really quite slight at this moment in time, particularly for businesses who are not in that healthcare industry. So please don't panic about the fact that COVID-19 is now a reportable disease. That being said, you do need to take caution. So you do need to be complying with the guidance as far as reasonably practicable. You do need to ensure that you can prove that you're doing so, and that's by having documentation in place that we've been talking about. And as a matter of precaution, we would recommend that you do keep a record of any instances of employees who have suffered from the disease or believed to have been doing so. Make a note of when that occurred and perhaps talk to them about if they are aware of where they may have contracted the virus from. In normal circumstances, I think it's very clear that being able, obviously track and trace is coming into force today, but being able to actually identify specifically where the virus has been contracted is very, very difficult at this moment in time. So like I say, try not to panic too much about it, but do take note of that. And if you do have an employee who is claiming to have contracted the virus within the workplace, please make sure that you take professional advice and consider notifying your insurer as well. Simon, was there anything else you wanted to add there on that?
No, a little bit on the track and trace. We've had a few inquiries in about that. Just reading around what has been released this morning. it's essentially the concern was that if one of your members of staff actually contracted or had symptoms, then you would have to shut your whole premises down. That was kind of the questions that we were getting recently. The information coming out from the government today is if that member of staff with symptoms has been within 2 meters of someone in your building for 15 minutes or longer, they are classed as being in close contact with that person, and that person would have to also self-isolate. So this is very new information that just came out this morning, so we'll be keeping an eye on that and see how that develops. But yeah, that's the latest information in relation to the whole track and trace and close contact side of things.
Okay, so want to move on now in terms of what the risks are of if you get this wrong, essentially. So this is fairly standard stuff. The first point here, that your responsibility as an employer is to protect anyone who could be affected by your work activities from harm. That is the crux of all health and safety legislation, that you need to be able to show that you are protecting anyone affected by your work activities from harm. So if you are not able to do that, then you are negligent in your duties as an employer, essentially. Second point there, unfortunately, using that dreaded word at the moment, unprecedented, it is an unprecedented situation. So the legal ramifications are really quite hard to predict at this moment in time. So in terms of what the risks are, yes, as an employer, you are liable for that protection from harm sort of scenario, but how this is going to play out over the coming 6, 12, 18 months is really hard to say at this moment in time. In terms of the COVID-19 risk assessment itself, as I said previously, there is no obligation to have this document signed off or checked by anyone prior to reopening, but as Simon mentioned previously, do bear in mind that your local authority and HSE cannot undertake spot checks at any time and are now starting to do so. So if you don't have this sort of documentation in place, then the usual consequences apply. So the HSE can undertake fee for intervention procedures. They can instigate prosecutions if they feel that's necessary. I think that's unlikely at this moment in time, but it is a consideration that you need to make. And you also need to consider the sort of intangible impact of poor compliance here. So the sort of employee morale, adverse publicity that you might get, and reputational damage. I have already heard of a shop in the southwest where a member of the public made an anonymous complaint about their practices. So it's really important to recognise that you need to be seen to be taking action, and you need to be doing everything that you can to make sure that you are putting preventative and protective measures into place. Ultimately, as it says there, health and safety legislation has always made it absolutely clear that financial pressures are absolutely zero defence against poor safety. So you cannot say, well, we couldn't afford to do this, or you know, we've already made a loss because of being closed, so our priority was just getting open as quickly as possible. That is not a defence for getting it wrong.
Can I just add something there?
Yeah.
The HSE, I think, took about 5,000 calls last week, anonymous calls from concerned employees and members of the public as well. I do believe that will be their focus now that they're inspecting again. So all it takes is for, you know, someone to not be happy with what they see in your shop, or a disgruntled member of staff, for them to give the HSE a call and for you to get a visit out of the blue. And we have seen that happen in the past, not specific to COVID, but specific to poor safety, or just a disgruntled employee causing issues. The other thing to note is the potential for no win, no fee solicitors to jump on this in about 6 months, 12 months time, to start, you know, you might start hearing radio adverts to say, oh, did your employer show you a COVID-19 risk assessment? If not, they were in breach. Speak to us and we can get you a payout of £5,000. So unfortunately, it is the time we live in, and I can see that potentially happening further down the line. And for the sake of just getting this paperwork in place, I would highly recommend getting this risk assessment done.
Okay. I'm aware that we're getting short on time now, so I'll move on quickly here. So this slide here is talking specifically about the safety pack that we have produced here at Rhino Safety. So as I said, we spent the time that we had with draft guidance looking through and seeing what measures needed to be put into place. And then when the official guidance was actually released, Simon and I pulled a bit of an all-nighter, to be honest, making sure that everything was up to speed. But we have, off the back of that, we have produced a specific COVID-19 safety pack for workplaces. And this is essentially all of the documentation that you need, not in template form. It's not a copy and paste job of the guidance. It is a working document for employers to put into place in the workplaces. It includes a COVID-19 secure policy. It includes the COVID-19 secure risk assessment. It includes safety memo for employees, first aid and RIDOR guidance, and weekly check sheets and essential signage as well. We've produced this to be emailed out, so as soon as people let us know that they want it, we can email it straight out. So this is something that you can implement virtually instantaneously, and it will make sure that you've got everything covered that you need. I know that the Chamber sent an email around about this yesterday, so there's more details on there, and you can obviously get in touch with us if you want more information as well. The details that you can see on the screen there. We are making this available, and it is obviously, we've written it in a way that it can be applicable to most workplaces. If you feel that you have got a very specific business or workplace that this might not be suitable for, please do feel free to get in touch, and we can let you know where you may need to be making any amendments or tweaks to it to make it applicable for your business. So we do have that available if people are worried about trying to get this documentation in place themselves, and want to know that they've got everything that they need in place. And there is, obviously, it says on there as well, a 10% discount for Chamber members on this pack as well. So that's us there, our various platforms that you can contact us on. And I would like to pass back now to Paul for any questions that people may have.
Okay, Kate, thank you very much for that presentation. I find it very useful. There's a lot of white noise out there. There's a lot of information that you can go to, and you've condensed it into a presentation that allows us just to get some headline views on what we need to do and sort of create that calm with businesses. And I think that's what we're finding is, businesses knowing where to turn, what to look for. So if anybody on the chat has got any, or on the presentation has got any questions, please feel free to go to the question and answer button. But we have got some questions already in. So I'll just fire away. Obviously, I know some of these are a grey area, so let's not worry about it if you can. We'll maybe try and follow up on them. I've got someone say, what actions are compulsory as opposed to advisory, e.g. hand sanitizers, floor markings, hand washing facilities? Is there anything that's ultimately compulsory is one of the questions.
Well, essentially what the HSE would say is based on your risk assessment.
Okay.
So that's the easy cop out.
Yeah.
But yeah, essentially hand sanitizer, yes. And getting the signage up, making sure people are aware of, the main one is social distancing. So it's keeping that 2 meter distance. That's the main control measure that the government want to see put in place.
Yeah.
I think it's worth pointing out as well, I mean, as I said, the guidance is exactly that. It's guidance, not legislation. It's in terms of, so technically you could say that none of it is compulsory, However, what the HSE would look at is it a measure that you can implement very reasonably and practicably? Things like providing hand sanitizer, I can't think of any reason why someone would not be able to do that. So it really is about making sure that you're doing everything that you can that is reasonably possible.
Okay, thank you. Another question that I've got in here is on that social distancing. This might move more to HR actually. What if a colleague is not properly socially distancing? I guess, you know, is not taking the rules and the guidelines that you're putting in place.
Yeah, if you put the guidelines, if you put guidelines in place and you communicate that with the staff under the health and safety regulations, you've got to enforce that as well. So if someone is not complying with the controls you're putting in place, that's a breach of health and safety. And Kate, correct me if I'm wrong, but that's immediate gross misconduct.
Potentially, yes. I would always advise caution with that. It's potentially gross misconduct to be in breach of that, yes. It is, you're right, Paul, it is a HR issue rather than health and safety, but that's something where I would say you need to make sure that you can show you have communicated those control measures with your staff so that they can't plead ignorance, and then you would need to be taking advice on the disciplinary measures that you want to put into place there. Simon did rightly say breach of health and safety is a potential gross misconduct issue. What I would say is that doesn't necessarily mean that you are going to be jumping straight to a dismissal situation. You need to make sure that you're following the correct procedures and acting proportionately to the actual breach. If you feel that someone is deliberately and maliciously breaching those control measures, then yeah, you've got a very serious situation there. But if someone has complained that someone bumped into them or you know, went into the kitchen while they were there and they shouldn't have done, you maybe need to take a slightly softer approach on that, but definitely take advice from HR and employment law professionals on that one.
But I think it also goes back to making sure you have done your risk assessment, it is written down, and you have communicated that with the staff. If you haven't done that, then you can't really complain if people aren't following the rules that they don't know about, if that makes sense.
Okay, thank you. Yeah, and I guess on that, we just had a question in from one of the attendees that would you need, or would it be good practice to get the employee to actually sign the health and safety policy or sign a document saying that they've read it? Is that, you know, advisable?
Yeah, it's always good practice to have a staff acknowledgement sheet with all documentation so that they sign to accept that they have been made aware of this documentation and that they understand it.
Yeah. Okay. Excellent. I've got one here that's what about shared buildings with different companies in a particular building? Is the responsibility on the landlord or the individual companies themselves?
Both. We're actually just dealing with this ourselves because our office is in a shared premises, and we were obviously much quicker off the mark on our own obligations than our property company were. There is dual responsibility there. So you are responsible for your own area, your own office. So for instance, in our office here, we have provided our own hand sanitizers within the office. We've done our own risk assessment for our office and our work activities. That's an important point because your landlord does not necessarily know what your individual work activities are once you've closed your office door. They are responsible for the communal areas. So things like cleaning of communal areas, any communal kitchens or bathrooms, access and egress from the building, that would be the landlord or the property company's responsibility in that case. Simon, anything to add there?
No, you're right. Yeah, landlord is responsible for the communal areas. You're responsible for your bit. Under health and safety, you do need to comply with each other. Our experience with landlords, it can be tricky. So yeah, as long as you're doing what you can do and covering your staff, and you communicated to the landlord, you know, that they need to do certain elements of that, then you can only do that much, you know.
You can only do what you can do.
Yeah.
Okay. And in on that note, we've had again another question from attendee. Am I allowed to involve furloughed staff in the risk assessment preparation?
Well, under the furlough rules, the staff can only do training. Now, however, the guidance in relation to risk assessment says you need to involve your staff with that. So there's a direct contradiction.
Yeah.
So I don't actually know the answer for that. For the way I would say it is, yes, I would involve my furloughed staff, because you could say that you are training them, you are showing them what the new procedures are going to be when they come back to work, or you are giving them a draft risk assessment and asking them for their input. I wouldn't say that was work, and I can't see how the government or the HSE can take exception to that, because you're doing something that's reasonable by preparing your work premises for use again. But I will have a look at that answer specifically and see if there is a definitive answer on that.
Yeah, I think I would. I mean, the furlough rules, from my perspective, and I'm only, again, it's seeking the guidance really, but it was that if you deal with any income generating activity, then you're not allowed to do that. But I guess this is in preparation. It's not in itself generating income, and therefore potentially you're able to involve them in the assessment. And as you said, training is possible. Just going back, again, one of the attendees just picking up on your landlord and tenant responsibilities and compliance. Would a landlord and a tenant likelihood share their risk assessments with each other? Is that something that's encouraged, or is that often just something that doesn't?
Yeah, like with a lot of the regulations and landlords, they do encourage communication and cooperation. So specifically under the fire regulations as well, fire regulations state you do need to cooperate, and certainly if the landlord controls the common areas, they need to communicate with the tenants. Now, that doesn't necessarily have to be sharing risk assessments, but it's just having that communication in relation to, well, what is the landlord going to do? Is the landlord going to be putting hand sanitizer on the entrance and exits to the building? They increase their cleaning regime in the common areas. And it's just having that conversation. You know, you could ask them for a formal risk assessment if you wanted to. There is obviously no harm. And they should be willing to, you know, to show you their risk assessment. And but I don't think there's anything specifically that says you have to.
Okay. Yeah. Okay. Thank you. I know we're getting close to the time stated, which was finishing about 3:30. But what about shared kitchen and communal facilities? How to make safe? Is there any guidance on that scenario? Obviously, people work close together.
Yeah. Again, it's
like
again, the government want the 2 meter social distancing. That's the number one priority that they want. Number one is that extra signage to make everyone aware, and then in the increased cleaning regime, and certainly like what Cate said before, the increased cleaning of touch points, so doors, lights, switches, taps, things like that. But you do need to have that conversation with your landlord. Certainly if you feel that they are not taking these controls seriously, you do need to have that conversation and make sure you spoke to them.
Yeah, I know that for us in our situation, our kitchens and bathrooms are communal, and they are very small as well. And the property company have implemented a 1 in, 1 out policy. So to try and ensure that social distancing is maintained. So that's definitely worthwhile thinking about, whether you're in a shared property or even if it's just you're in a self-contained premises. If you have got those kind of smaller rooms, having a 1 in, 1 out policy is definitely worth consideration.
Okay, and we've just got attendee asking about what exactly do you mean by signage?
Okay, so sorry, go on, Simon.
No, you go on. Ladies first.
So the sort of signage that is being recommended is things like reminders for the frequent and thorough hand washing, reminders for social distancing, There is one thing to point out actually is there is a very specific certificate that needs to be downloaded from the guidance website, the government's guidance website, that you need to display in your workplace to show that you are COVID-19 secure compliant. We've included the link to that certificate in our pack, but you can just jump onto the government website to get that. So that is, I guess, another form of the signage that needs to be included. But you need to think about signage that is applicable to your own workplace. And this doesn't have to be something that you have to go out and spend loads of money on. You can literally put these signs together yourself, print them off yourself, laminate them and put them around your premises, which is what we've done. So it is those kind of general reminders for social distancing, good hygiene practices, hand washing reminders. That's the sort of thing that you need to be thinking about with your signage.
Yeah, like Kate said, it does need to be specific to your working environment. I was on a construction site yesterday, and they've had to put signs up that say no spitting, which I thought was quite interesting. So you do need to be aware of your environment, and just the signage needs to be appropriate to that. Yeah.
Okay. Thank you. Okay. Maybe one more question just to finish off, unless there's any more that come through from the attendees. The responsibility for the commute to work for clearly feels like it should be employees' responsibility, but is there is it down to employer to make safe as well, or to help and support?
Yeah, this is quite an interesting one, because it is referred to in the guidance that employees should be encouraged to avoid public transport if possible.
Okay.
So some of the measures that are suggested for that are to increase the number of car parking spaces available. I don't know how businesses are expected to be able to do that if you're in a an environment where you've got a car park with so many spaces, you can't magic them up out of thin air. But car sharing should be avoided. And there should be extra space made available for things like bicycles to encourage people to use alternative methods of coming to work. So there is definitely a responsibility on the employer to encourage the avoidance of public transport. However, that is not something that an employer could be held liable for if an employee was either unwilling or unable to actually do that.
Okay. Well, thank you very much. Thank you for that. Very, very useful and thought-provoking and helpful to sort of take us people forward. We haven't got any more questions, and we've reached our time. So I want to take this opportunity to thank you for your presentation on behalf of the people that have attended. I hope those that have attended today have found this very useful. Any feedback is welcome. I'm sure Don will send something out. We're obviously keen to find out of any topics, presentations that you might feel would be important to your business at this time, or things that you're dealing with that we may be able to put you in touch with an expert. So once again, thank you to Cate and Simon, Rhino Safety, our premium members. And we're going to put this webinar on our YouTube account so that people can revisit it. Yeah, and thank you. If people want to look out for our future webinars that were taking place, we've got many more planned as we go forward. So thank you for that.